Informatics is not just about technology. That's one half of it. Informatics is also about process. On this episode, I want to talk about how I found my preferred niche in healthcare informatics as a nurse. Believe it or not, I found my first interest in informatics working at a federally qualified health center. Hello everyone, welcome back to my YouTube channel. My name is Brianna. For those of you who do not know me, I am a nurse doing my thing away from the bedside and in the field of healthcare informatics. Today, I'm going to tell you a little bit about what a federally qualified health center is, what I did there, and what things caught my interest that ideally really started to develop and nurture this interest within healthcare informatics. I know that when people think about nursing informatics, their first thought is working with EHR systems and usually imagine someone who is working in a hospital with EHR systems or maybe different technologies. But I don't know that many nurses think about informatics in many other arenas. And this may be due to how we went to nursing school and what our clinical mindset is when it comes to informatics in general. It's usually one of the smaller subjects that we really touch on. For me, it was towards the end of my nursing courses. Definitely stay tuned. I would love to hear your thoughts at the end of the video. Please feel free to share any hidden gems, any thoughts you have around healthcare informatics, or if you are practicing in this area as a nurse. That'll be very helpful for my viewers and the community that I'm hoping to continue to grow here. Let's talk about what a federally qualified health center is, also known as an FQHC. In its most basic definition, an outpatient or community health setting. So imagine a doctor's office setting where you go in, you see your primary care doctor or maybe the nurse practitioner, and you address maybe some chronic health issues, high blood pressure, or getting some medications refilled. Maybe you need to come in for your pap smear or you're checking for STDs. They provide these services to the local or surrounding community because they are a community health center. And so you'll typically find them in urban or rural settings. They are serving the underserved populations. This can be populations like immigrants, migrants, homeless, those who are on the verge of being homeless, those who have a certain level of income, the underserved population. FQHCs also aim to be a one-stop shop. Ideally, patients can see their PCP, maybe also the dentist, their gynecologist, maybe children can get vaccines there. Providers can refer patients in-house and try to meet all the care that that person needs in one facility. So these are the kinds of people that you don't want to lose. They need healthcare the most. And so you want to make sure that you can address their needs while they're there at that point in time, and you don't really make it hard for them to navigate the healthcare system. So a little bit about what I did there. As a nurse, I worked with a small team of medical assistants. I was a manager of that small team, and I worked with nurse practitioners and the physicians who saw patients and represented our nursing team, helped medical assistants room in the patients as they came to the facility and prep them to be seen by the providers. I also was introduced to the quality improvement part for that facility, kind of trying to figure out how to implement better practices in workflow, better practices when it came to direct patient care and better charting and just basically making sure that the overall flow for the daily tasks could be at its best. I liked the idea of thinking through what we did and how we could make it better. This also initiated some thought processes around how we were gathering data, how we were storing that data so that we could later then retrieve the data to make sense of what our outcomes were. But it's really hard not just in an FQHC, but in general. It's hard when folks are working with in-house databases like an Excel database or something very sort of simplistic that is not really analytical in a sense, unless you really have someone who is of an analytical mindset and can use those special formulas or format the information in such a way that's easy to manipulate and generate reports. So there's this document I was reading that the CDC had recently released about the Public Health Modern Data Initiative. And I just want to read this one sentence that stood out to me and kind of brought me back to my experience at the FQHC. Currently, health systems provide data to public health through multiple channels. Too often, the burden of implementing these solutions is so high that frontline public health professionals are forced to fall back on phone calls, paper forms, and faxes. As a result, clinicians are unduly burdened with filling out paper forms instead of delivering needed care, or they simply do not report what is needed to public health. This didn't just make me think of the FQHC, it made me think about healthcare in general, how sometimes these fancy systems and these fancy way we have to go about doing things can take away from the bottom line. It might even take away from getting things done quicker, because you would think that the system helps you to get things done quicker, but sometimes even the systems can be unduly. So there's this caveat between healthcare technology making things better and healthcare technology making things work, and finding that fine balance. Just like everything, there's nothing that's perfect, but I still think that it's such an interesting niche to be in, especially with the varying clinical experiences that nurses bring to the table. This being one of my first experiences in nursing, I didn't realize it then, but when I look back on it, I realized that is where I really found my first interest in the niche of healthcare informatics. Give me some feedback. You should definitely subscribe for more. Share this information with others who are going to share it with others who are going to share it with others. And that's it, guys. I will see you on the next episode. Bye.